Hi, my name is Lachlan Fitzgerald and this is my presentation for Concepts of Pharmacology. The drug that I'm presenting on is Flumazenil. Flumazenil is kept as clear liquid and must be stored below 25 degrees Celsius. The pharmacokinetics of Flumazenil are interesting. In terms of absorption, it is most often injected directly into the bloodstream. In Australia, it is only approved to be administered intravenously, and it is almost always administered by an anesthesiologist or experienced physician. This is to reduce the amount of medication errors that occur. There have been other routes of administration tried, but intravenously remains the preferred and most effective option. This contributes to its fast onset of therapeutic effects. Flumazenil is a lipophilic drug, which means it is absorbed into fats rather than into water. It is mainly distributed in the extravascular space, the space surrounding the cells filled largely with interstitial fluid. Flumazenil has an initial distribution half-life of 4 minutes and a terminal half-life of approximately 53 minutes. It is almost entirely metabolized, with more than 99% of the drug being metabolized, and less than 1% that is eliminated is unmetabolized. This is because it is lipophilic. Flumazenil is typically out of the body within 2 to 3 days, and this is primarily through the urine, with about 90% being found in the urine, with a small amount being eliminated through the feces. Flumazenil's primary mechanism of action comes from its bindings to gamma-aminobutyric acid receptors, thus nullifying benzodiazepines and other drugs which promote the binding of gamma-aminobutyric acid to its receptors. This reverses the effects of benzodiazepines, which are a drug that can depress the respiratory rate, cause excessive drowsiness, and in rare cases lead to death. This is the primary goal of Flumazenil administration. It competes with benzodiazepines for the gamma-aminobutyric acid receptors, thus almost completely reversing its effects. This includes all effects of benzodiazepines, including therapeutic effects. It is generally a quick-acting drug owing to its intravenous route of administration, and begins showing effects within 1 to 3 minutes of administration, with its peak effect occurring 5 to 10 minutes after administration. Because it seeks to completely reverse the effects of benzodiazepine, it can induce withdrawal symptoms in some patients. Therefore, it is often important to know if the patient has an addiction. It is also important to note that seizures are one of the most common side effects of Flumazenil. Other side effects include anxiety and panic attack, neurological effects, and cardiovascular findings. Flumazenil is a Schedule IV drug in Australia. That means that it is prescription-only medication and must be prescribed by a doctor. It is often then administered by an anesthesiologist through an intravenous injection or a cannula. Patients that receive Flumazenil then remain under observation in hospital. This is typically undertaken by a doctor and/or a registered nurse. For that reason, it is not allowed to be used in short stay or outpatients in Australia. It is also not allowed to be used as a diagnostic tool in Australia. Certain reactions to Flumazenil can indicate a benzodiazepine overdose. However, in Australia, Flumazenil is only to be used for treatment rather than diagnosis. The most important questions for a person that requires Flumazenil is to see if they have a history of seizures or panic attack, as well as to see if they are taking benzodiazepines for a life-threatening condition, and to see if they have a hypersensitivity or allergy to any of the chemicals that are contained in the medication. Seizures are one of the most common side effects of Flumazenil, so for a patient with a condition such as epilepsy, it would be preferable to find another method of treatment, such as treating with supporting measures only. For patients taking benzodiazepines for a life-threatening condition such as intracranial pressure, it would be severely dangerous to take Flumazenil, as it would reverse all the effects of the benzodiazepine. Allergy and hypersensitivity is an important counseling consideration for all medications, and Flumazenil is no exception. Here are some multiple choice questions. What is Flumazenil's route of administration? A. Intramuscular, B. Intravenous, C. Oral, or D. Subcutaneous? It is B. Intravenous. How is Flumazenil primarily eliminated from the body? A. Urine, B. Sweat, or C. Feces? It's A. Urine. What schedule does Flumazenil belong to in Australia? A. Schedule 2, B. Schedule 3, C. Schedule 4, or D. Schedule 8? It is C. Schedule 4. Thanks for listening to my presentation.